Hello everyone. Today I will be talking about hypertension. It is becoming a growing problem in the world. Currently, hypertension contributes to the two leading causes of death in the world, which are stroke and coronary heart disease. However, what I'm about to tell you might just save your life. Let's start with the basics. Hypertension is basically high blood pressure. It is considered a cardiovascular disease. As the blood pressure increases, the pressure on the veins and arteries increase as well. As this pressure goes up, hypertension starts to get worse and the risk of having a cardiovascular emergency increases. There's more pressure on the heart too, because it has to work harder and faster to pump blood throughout the body. The reason why hypertension is one of the most dangerous diseases on the planet is because it has little to no symptoms. Although people with hypertension may experience bloody noses, fevers, and headaches, these symptoms appear very rarely. Your best bet is to use a sphygmomanometer. This machine shows the diastolic and systolic pressure. The systolic pressure is the pressure in your arteries during the contraction of certain muscles. The diastolic pressure is the pressure on the heart every time it beats. There are 5 blood pressure levels shown on the screen. In normal blood pressure, the diastolic is below 80 and the systolic is below 120. In elevated blood pressure, the diastolic still remains below 80, but the systolic rises to between 120 and 129. A change in lifestyle is recommended, but not required. In stage 1 hypertension, the diastolic is between 80 and 89, and the systolic is between 130 and 139. Change in lifestyle is highly recommended, and medication might be necessary. Stage 2 hypertension occurs when the diastolic is at least 90 and the systolic is at least 140. You should consult a doctor immediately. Doctors will usually prescribe a large variety of medications that will lower your blood pressure. A hypertensive crisis occurs when the diastolic is over 120 and the systolic is over 180. Call 911 if you are feeling symptoms of hypertension, such as numbness or difficulty speaking. You may be experiencing a cardiovascular emergency. Some people are at a higher risk of getting hypertension. The biggest risk factor is family history. People who have many ancestors who have had hypertension are at the highest risk of getting it. Other risk factors include health, weight, race, gender, and habits. Sometimes people who have certain diseases can get hypertension more easily or they can get a more severe type of hypertension. People who are bigger are usually at a risk of hypertension. Also, African Americans are at a much higher risk as well. Scientists believe they are at a higher risk because of their diet. From studies, African Americans eat the Southern diet, which involves fatty foods, fried chicken, and other unhealthy foods. Genes are also a problem for them. Younger men and older women are more vulnerable. However, men and women are at a similar risk overall. Smoking and drinking alcohol raise the chances of getting hypertension as well. To prevent hypertension, the best thing to try to do is not get it in the first place. Diet is vital. To prevent hypertension, a diet with low salt but high potassium is recommended. Potassium digests salt, and that lowers blood pressure. Replace frozen, packaged, sugary, and fatty foods with fresh fruits and vegetables. The person on diet should not consume too much meat. To make up for these lost nutrients, the person should consume a variety of vegetables. Besides having a good diet, there are other ways to lower your blood pressure. Exercising every day for at least 30 minutes decreases the chances of getting hypertension. High blood pressure is another reason why people should stop smoking or drinking, as both of these, as mentioned before, may cause hypertension. Too much stress increases blood pressure temporarily and in the long run. This does not mean you can go back to smoking and drinking to relieve the stress. Find another way to calm yourself down, such as listening to music. If you have made numerous changes but your blood pressure is still high, maybe medications would be a better solution. Medications may help, but they sometimes have some side effects, so they are not always the best way of treating a high blood pressure. Taking medications matters on the diagnosis most of the time. You should consult your doctor before using one. The most common hypertension medications include ACE inhibitors, ARBs, beta blockers, calcium channel blockers, and diuretics. I will explain them in the next slide. ACE inhibitors protect the kidneys and expand blood vessels by blocking out certain hormones. This improves ejection fraction and connective tissue disease. These medications increase the chances of survival, and they work well in young and white people. However, they may cause angioedema, which is the swelling in the mouth and the neck. It also causes coughing. Angiotensin II antagonists works very similarly like ACE inhibitors. However, they have much fewer major side effects. Beta blockers improve congestive heart failure and post-MI. They work well in young and white people, but it may cause an increase in cholesterol and lipids. Depression also increases. Asthma problems may worsen, and this can cause COPD and bronchospasm. Calcium channel blockers, unlike other drugs, do not improve survival. It works well in African Americans and elderly people. It may cause vasodilation, reduce contractility of the heart, may cause constipation and edema, and quite ironically, increased heart rate and heart failure. Diuretics, just like calcium channel blockers, does not improve the chances of survival. They work well in African Americans, elderly people, and Americans. They may cause a decrease in potassium, an increase or decrease in calcium depending on the medication, an increase in uric acid, lipids, and the amount of glucose in the body, which is bad for diabetes. 48% of Americans will get hypertension sometime in their life, which means half of all of you will get hypertension. Protect yourself by eating a good diet, exercising well, and being happy most of the time. Live a balanced life, no more, no less. Keeping a sphygmomanometer in your home might be helpful so you can keep track of your blood pressure. Save yourself before the silent killer gets you.